One thing that I was really reminded of these past few days is that I need to have a much higher index of suspicion for a possible stroke, especially in patients who are demented and, you oftentimes just chalk it up to delirium. This morning, they did end up calling a stroke code on one of the patients. I was considering getting a stroke, a CT head for them. And then in the morning, I was wondering, did I not make the right call? Should I have gotten that CT head overnight? So when I was an intern on the VA, there was this patient who all of a sudden became altered. I didn't get a CT at that time, and they ended up having like a massive stroke. And that was kind of tough for me. I think that was a really big learning lesson for me. In the end, when they called the stroke code in the morning, they ended up not seeing anything on the CT. The patient ended up becoming back at baseline. So that was a big relief. But what I really took away from this is that I need to be doing a much more thorough neurologic exam and have a lower threshold for getting a CT scan, even if they don't have any neurologic deficits. So that's something I'm definitely going to take away from this week.